This is Dr. Lin, but today I am Uncle Justin. I am taking care of my nephew Elliot. Say hi, Elliot. Hi to everyone.
Hi.
Yeah, all everyone out there. We're gonna take a look at his foot. There's some stuff. We're getting him to start running, and you're having fun, right, Elliot, running? And we're gonna keep you running for a long time. So I think it's always a great age for us at any time to start looking at these dysfunctions, even though he doesn't have pain. Do you have any pain? No? What is pain? Yeah, he doesn't know what that means. So, this is way ahead, and my sister was okay with this, and Elliot's gonna be a great participant today, and we're gonna check out some different things. So we're gonna get started right away and see how we can help him, right? Yep. And he's growing. So he's 5 years old, right? You're 5 years old? Yeah, all right, that's good. Why don't you sit over here, buddy? Yeah, okay, I'm gonna check some things out like I did last time. That I wanna see if you have that flexibility. And these are the kids that can't, they can't touch their toes, right? Are you able to touch your toes, Elliot? Try to touch your toes. Try to touch your toes. Like this. Yeah, and it is straining, right here. I feel a lot of pressure in his lower back. Right here, do you feel some tightness? Yeah, okay. All right, so we got to get that better a little bit. And I have a feeling sometimes it happens. Some people are born with tight nerves, but as he's growing, and that's kind of what we're at. Then I want to take a look at his foot. I've been noticing this since he was a little kid, and I've been wanting to get this, but his foot's starting to kind of go over a little bit, and he's starting to get that early signs of the bunion, right? But when he stands, it's going to be very different. I'm going to have him stand here in a little bit, okay? But this side's a little bit more efficient, meatier, and you have more meat on this side, Elliot. You got that, yeah, and less meat. And an ouchie right here, right? You got an ouchie. Okay, so I'm gonna have you stand up. I'm gonna pick you up, okay? I'm gonna have you stand up right here. All right, good. And so if we look at your feet, Elliot, look, we're gonna look at your feet. You see how this one collapses? This one's down here. This one's straighter. You feel it? And over here. So if we can try to improve that today, you're gonna run much faster. You like that? Yeah, good job. All right, so I'm gonna get you down. All right. So I think there's a couple things I wanna look at for him over here. But let's go ahead and line your back here. Head here, you can look up the ceiling. Face up. Nice. All right. Okay, Elliot, if anything feels uncomfortable, you just let me know, okay? Okay, and we'll stop. All right, put this underneath your feet. Now you get to live like a king. Feel good? All right, I'm gonna check other nerve stuff on my buddy here. You gotta look out for him in the Olympics in the future. He's fast, so. And he's okay here for now. And then I'm gonna hold him this side. And here. I'm gonna check your stomach, okay? So I'm gonna take a look here and see. So I feel this side's good. You feel how loose this side is? And then on this side, it's a little tighter too. So, I'm just gonna start bringing up a few things here in his organs. Is your stomach, buddy? Remember you were having a lot of hiccups the other day? I think it sometimes comes from here. I'm gonna put a little pressure here, okay? Very good. He's gonna earn his candy today, so I picked out a great Jolly Rancher. We're gonna give it to him after. He's excited, right? You're looking forward to the grape Jolly Rancher? I might even give you 2, as long as you don't tell mom, right? Good. That's good. So, we want these things to be free, okay? So there's something here too. This looks good here, and then over on top, right here, is this motion right here, right here. Can you do this for me? Just do that motion. Good job. Is that okay? How's it? And these, kids, they're fast. Things move really fast here. And, if we can get them in right away, we can accomplish quite a bit. He's doing really well. I'm gonna check up here, okay, buddy? I'm gonna check right here. Yeah, just leave your head right here. just kind of look up towards the ceiling. I want to see how these things are. Anywhere that we can get nerve freed up, we're going to try to get nerve freed up. And, you know, I just got a little here. You know. Alright. So Uncle's going to put his hand here. Alright. Good. What are you thinking about? Hi, Elliot. Anything good? So Elliot, when he grows up, wants to be a fireman, or he wants to work with ambulances, and it'll be good. Excited. You can help people, right? Isn't that your dream? Why do you want to be a fireman? Because what? Because you just like to, huh? Okay. What other thing? Do you like the uniforms? They're pretty cool, huh? Yeah, so let's sport a nice uniform in the future. Yeah. And so what right now, what I'm doing all is just kind of connecting the dots a little bit, just trying to free up some nerves underneath his spine. A little twisted. So you have a little bit of a twist here, Elliot. Okay? Good. Okay, so I'm gonna check here. Let's take a look at nerve tension again. Remember your nerve tension? Yeah, do you see how, what happens when I do that? You can see it down here. You drop right into the table. We gotta get that better. So, and then on this side, same thing. Let me see this side. Good job. Relax, 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 good. And that side's tight too. But I think it comes from his pelvis. Your pelvis. I'm gonna help this a little bit, okay? Bend both knees. You wanna help me? You grab here, and you grab here. Good. And I'm gonna put pressure right here and here, okay? And just kind of, and then when I ask you to, you push against your own hand, okay? Go ahead and push against your own hand. Push. And then your legs have to push against your hand too. Good. So his sacrum's a little bit tight. Really tight here. Feel that? Right in here. Good job. Let me see that again. So in a good world, we can be very flexible like Elliot here. And I wish I could do that a lot more. He's doing good. And then I'm gonna kind of move down these other segments of his sacrum. So you're gonna push against my hand, okay? Push. Push, Elliot. Yeah, good. No, only with your legs. Only with your legs. Push. Yeah. It feels like a burning, right? It's looser, I promise. This is just some soft tissue thing that we're really working on, trying to free up his nerves. We want to get these all better. Try that again. Let's see if his nerves got a little bit better. Okay, it's getting a little looser. I just feel a lot of stuff in the front. So I think his bladder is actually sunken in. You know what a bladder is? What's a bladder? I don't know, me neither. I don't know why we have it, but it's important somewhere, I think. You feel okay? Just wave if you're not feeling okay, okay? Good job. So proud of you, bud. I'm just putting pressure here. What does it feel like? What does it feel like when I'm pressing? Hi, Elliot. Is it uncomfortable? Is it comfortable? Does it make you want to feel like tickling? Or it hurts a little bit? Oh, sorry, buddy. Doing good though. Let me see. Let me show you this. I think it's gonna get better. Relax, relax. Oh, look at that. That's a lot better. Now we're just gonna a little pressure here, okay? We're gonna free that up. I'm gonna block here and just hold against me, okay? Push. Oh, yep. Your leg. Push me. Push me. Got it? That was good. Strong. Alright. That's a lot better here. Got a little bit of tension right here. Do you feel something tension? Does it feel tickly? So I'm on his nerve and that's why he feels a little tickly. I'm just gonna hold it right here, okay? You do this motion very slowly. Yeah, you got it? Little pain, right? Wave to the camera. Doing good. You're doing great. Okay, try it again. Let me see it again. Is it getting looser? Yeah, you're getting looser and straighter. Okay, relax. Relax, relax, relax. Good. Let's try it on this side, okay? Relax, relax. Let me have it, let me have it. Same thing, right around here, right? That nerve. That nerve. Alright, you do the same motion. Straighten your leg. Yeah, and back. Good job. Always following directions. You know, great story about Elliot. You know, when he was about 4 years old, I took him running around the track just because my sister kept saying that he likes to run around in circles around the staircase. And he would run about 100, 115 times before he gets really tired. Right, Elliot? You like to run around circles, right? And then I just asked her, I was like, you ever take him out to the track? So for some of you, that know me, I ran track at Boston University. So, I was like, let's take him out to the track. And we took him out and Elliot did a great job. He actually stayed on the lane, stayed in the lane. Yup, and he ran the whole way, which I thought was really impressive. And then, around the second lap, he came up with this funny thing and he asked me, he goes, Uncle, do you want to get closer you want to get to the finish line faster? And I said, well, how do you do that? And then he points and he goes right across, like cut across the field and get to the beginning. So I said, no, we can't do that, we have to follow the rules. And then he slumped down, he's like, right? Remember that? So he's like, I wish I could cut across, but he did all 4 laps with me. We're not going fast, but enough to get these things a little bit more free. So why is these things going on in his body? He's so young. I don't know, Elliot. I think, like I said, I think some people are just born with it. I think myself, I was born with this nerve tension. Started early, doesn't experience pain, but look at that. How's that feeling? That's great. I'm gonna check your tailbone, okay? Bend your knees. Bend your knees. Good. He's doing great. So I haven't even worked on his foot yet, and so his tailbone is compressed. And you're gonna do this motion for me. Side to side. You got that. I'm gonna pull right here. Is that okay? So he's got this little bitty tailbone right now, and I'm just trying to pull it and give him some space. And as I pull, I also feel tension from his neck. So I'm gonna find that here, and he's gonna help me wiggle it out. We're gonna try to get nerve length early on, so he doesn't have to run into the same problems I had as I was getting older. So, I had weird shin splint pain, growing pains. Uncle had a lot of bad stuff. And then I had surgery, for all these things that felt weird and felt tight. Go ahead, keep moving. Yeah, feels soft. This is okay? No pain, right? So, really excited to help him out. They live in Washington State, so, right? You're a Washingtonian. Is that right? Yeah. What did you say to Mom and Dad? You said you're from Ohio, though? Or from Indiana? When did you say that? So my brother-in-law's from Indiana. He said, they're like, where are you from? And they said, he's like, Indiana. And they're like, I think my sister and brother-in-law had to correct him, from Washington State. Good. Let's see how this feels now. Ready? Whoa. No. Stop picking your scab. Good. Okay, you want to stand? Let's see how you feel right now. I'll get you up, and we're going to stand. Let's look at his foot again. Okay, so, it's starting to be a little bit more straighter. I haven't done anything to his foot. Go ahead and march in place. Yeah, and that's great because this makes my job easier. But that's actually starting to look straighter. Do you see that, Elliot? Look down. Look, you know how it doesn't push down as much. So we're gonna get you back down, okay? Uncle's gonna work with the rest. All right, now you're here. Lift. Yep. There you go. Nice. Doesn't this feel good? How to sleep? Yeah, so he likes to sleep on his stomach. I've been trying to tell him not to. but you know, it's still fun. Oh, you didn't sleep today on your stomach? Good job. So I'm trying to teach him to change his habits early on. But habits are hard to change. What did you say? Sleeping? You don't want to change it. It's like giving up food, right? You don't want to give up your food. So what I'm going to have here, I'm going to bring something in here. I have Dysum. Dysum helps me get more grip. Okay, Elliot? So I just want to try to start moving some things here. So he has a collapsed cuboid. So if you come down and look at this here, you know, right over here, that's doing okay. But over here on his right leg, he's got this collapsed middle arch. And this bone is starting to pop out. Do you see that, Elliot? This bone. This one's okay. So we can try to get something a little bit more free. So I'm gonna free up some little things here. Tickle. Yeah, good job. Good. And so all these things are connected by muscles. And so right now, he's so young, it's not a joint issue, I don't think. It's just muscle tension or nerve tension. And he doesn't, you know, right now is a good time to get this taken care of. So, you know when you're older it takes longer? Wouldn't you think so? Right, Elliot? Good. There we go. It's doing good. He's feeling looser? Look. Yeah. So I want that up there. Something's not keeping him there, but that should be nice and mobile, like this. Do you know that? Your foot should go this way, and your foot should go this way. Your foot goes this way, but doesn't go this way. So what I'm gonna do over here on this right leg, relax for me, buddy. Yeah. I'm gonna have you do this to your toes. Open, close, open, close. Yeah, so he's gonna open, close. I'm actually move this to the side here. Good. Open and close. You feel that? Good. Now I'm gonna use my handy Dysum here and get some here. And you're gonna press into my hand here, okay? Push. Push. Good. Is that okay? So I had to give it a little, that was a little tough, you know, he's already 5 years old, you know, his ankle already, but remember that? Here and here, look at that. So I'm gonna get this stuff real early on, nip it in the bud, right? What is the bud? Yeah, the bud. You'll learn all this one day, I'll teach you. So I just want this to go up a little bit. There's something pulling me right in here. Do you feel that? Right in here. He doesn't really feel it. He's just nodding, everyone, but that's okay. As long as he's not screaming. He's gonna earn 2 great Jolly Ranchers. You excited? It's like the marshmallow test. Just gotta wait, and then you can get.
Wait, dude, that's wonderful, and then you rub it on the tape.
What? You rub what on the tape? Marshmallows? Oh no. You did a test like that? Okay, so look at that foot now. He's starting to get that arch. Can you do this? Do this with your toes? Yeah. So he's trying to strengthen that. I want him to strengthen right over this guy. You okay? Good job. So that's starting to look really good on these ends. These feet here, and now I gotta start working on this big toe. Look at that. I got your big toe. So we're gonna work on that, okay? This is okay. We're trying to get this arch all freed up. You know, super tight arch. But we want to keep you nice and flexible. How's that? Do that. Yep. Push into my fingers. Crawl my fingers. Go. 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 Crawl my fingers. Claw them. Yeah, hold. hold, push me. Yeah. Good. All right, let's see that one. We're gonna check that out in a minute. It's not perfect. I need to, have him probably one more time a little bit, but I think for today it's doing all right. Good. Let's check this side. So this side, the only thing I saw about this side was this part collapsing right in here. When he does that, right in here, right? Yeah. I have the same pants. Did I tell you that? But for adults, probably get your whole body. Okay. All I want to do here, buddy, is just open this up, okay? So, I want to see if we can make automatic happen. Automatic's really important here. And, doing a great job. You okay? Good. Look at that. Starting to go well here. Did it feel looser? So he must have tripped or something like that and caught this part. But, it's an ankle sprain that most people would, a small ankle sprain that most people would forget, but that's already a lot looser. You feel that? You do this. Good. All right. So let's see if he's got his core response. I'm always curious if everyone your age has a core response. So let's see. Hold this here, okay? Hold this. Let your hand down. You're gonna push into my hand here. Go ahead. Nope, this hand. Good. And push. Oh, so he's using his hip flexor on this side. You see how loose that is? Let's see this side. Hold this side. Hold. Oh, you see how your stomach is kicking in? He's got a good response on this side. So we gotta get this side stronger. Something happened to collapse this arch, probably missing from his core. That's my thought process here. You understand that, Elliot? So your stomach is the most important muscle in your body. The stomach muscles. Right here, okay? Hold. Push against me. Yeah, and hold. No cheating. Come on, you can do this. Here, push your big toe against my finger. And this leg against me. And hold. Slowly let me win. Push me again. Up to your nose. Good. No cheating. You can do this. Good. Push me again. Go. Toward your nose. Good. Hold. And the great thing is these neural connections kick in. He's already kicking that in nicely. Now hold. One more time, okay? We're gonna go like this. Follow me. Alright, let's do it again. So when he was crawling as an infant, I noticed that he wasn't crawling as efficiently as possible. And I always knew it was gonna be one of these sides. Pull me up. All the way up. And good. And again. So it would have been nice to see him crawl before and after, but the running we'll have to do. Right? You ready to stand up? Let's see how this looks. Alright. Good. Alright, let's take a look at his feet. Whoa, you got an arch again. Especially that side. That's really important. You're gonna march in place, okay? Does it feel different? What do you feel like? Does it feel lighter or does it feel easier? Oh yeah, stand on one leg. Let me see. I'll hold you. Nice. And that's that line we want. Okay, why don't you face over here? Yep. Stand on this leg, okay? I should have checked this out earlier, but Elliot has had a balance concern as well. Okay, good. Yep, and this side. Nice job, bud. Great, have a seat. All right. Well, thank you, Elliot, for coming in and hanging out with Uncle. I got to help. You got to help out. I got to help me out. We did good. We're gonna show him running a little bit later, but this is Elliot Blauvelt. Check him out in about 20 years. He'll be in the Olympics. I think that's your plan, right? And or a firefighter near you. Way back there, everybody. All right, I'm Dr. Lin of Rehab Revive. Remember, if you like what we're doing, please subscribe. We got fun guests coming in. Maybe I'll treat my niece next. Please subscribe. Leave a little comments or email us at rehabandrevivemedia@gmail.com. And remember, we can and we will get better together. Bye, everyone. All right. One, two, three, go. Yeah. So I want you to notice he's swinging both arms that he wasn't doing before. So we'll do it before and after clip. All right. Ready? 1, 2, 3, go. Go. All right, build this one faster. This one faster. All right, we're gonna go again. 10. 1, 2, 3, go. One, 2, 3, go. More coordinated, timing's better. That's great. Walking's looking a lot better, so good job. Say goodbye to everyone.